from the station that's on your side. This is Channel 7 News Daybreak.
Welcome back into Daybreak. Diabetes is a very common disease with an increased risk for medical complications if not appropriately diagnosed and treated. So what does that mean for your heart? Joining us this morning is Baptist Health cardiologist Dr. Anthony Fletcher to explain. Dr. Fletcher, good morning to you. Thank you so much for being here this morning. This is something that we just mentioned, very common, and of course everybody wants a healthy heart. How does something like diabetes affect the heart?
Well, diabetes is a major risk factor for cardiovascular disease and stroke. 68% of people 65 or older will die from diabetic-related complications as a result of cardiovascular disease.
Wow.
And people with diabetes also have about a 3 to 4% chance of having more deaths from stroke and heart attack as opposed to people who don't have diabetes and are adults. So diabetes is a major contributor to cardiovascular disease. In addition to that, complications from diabetes, such as we've talked before about peripheral vascular disease, PAD, that is one of the major risk factors. That and cigarette smoking are probably the number 1 and 2 causes for PAD or peripheral vascular disease.
Wow.
That meaning people losing limbs and having amputations and disabilities as a result of that. So again, diabetes is a major risk factor with that.
Okay, so what's the actual link? How does something like diabetes really correlate to the heart?
Absolutely.
What's the link?
Diabetes is, to me, like an accelerant to a fire.
Okay.
You have underlying diseases in terms of problems with hypertension and high cholesterol and obesity and family history. Those are some of the major risk factors for cardiovascular disease. Smoking, again, is another one. But you put diabetes on top of that, and this whole process seems to burn faster and more extensive. The diabetic patient may have long narrowings in their arteries as opposed to discrete focal narrowings. And those arteries are smaller, not by design, by birth, but they're smaller because the whole artery is diseased. So it sort of makes the whole process a little bit more involved and a little bit more complicated and sometimes even harder to treat because the artery is a less healthy artery, for instance, to treat. And again, same thing with stroke. The increased risk for the patient having a stroke is also associated with the concomitant presence of diabetes.
Okay, if you are diabetic, which is something that if you have not already talked with your cardiologist about or your doctor about, speak with the cardiologist and make sure that you stay heart healthy. You don't want to fall into those statistical categories that we mentioned this morning. And Dr. Fletcher, thank you for coming in, explaining how all this works. And you can always contact Baptist Health at the Baptist Health line, and you can always go to Baptist-Health.com for more. Dr. Fletcher, we'll see you next time. Thanks for coming in early this morning with us. Have a great day.